Atay with the Brigham and Women's Hospital. Our poster had kind of two objectives. Our first was to see what percentage of patients who are already on warfarin would qualify to be on dabigatran based off of Rely and Recover inclusion and exclusion criteria. And we actually found that a majority of patients would be eligible to switch. It's about 93.5%. Our second objective was to see what would be some of the direct costs associated with switching all of those patients from warfarin to dabigatran. So we just looked at some of the costs that would be most important to patients and prescribers and some hospital administrators. So with warfarin, a lot of the costs are drug acquisition costs, labor costs, and laboratory costs. So over here on this graph, for all of our patients who did qualify for warfarin, it costs about $1,385,000 to manage those patients. If all those patients were transitioned over to dabigatran, the labor and laboratory costs go away, but the drug cost remains, which is actually over $4 million. You know, when we did this analysis, we thought it would maybe be the other way or it would be equivalent, so we were actually surprised to see that the drug cost of dabigatran did outweigh the therapeutic cost of warfarin management. Some of our limitations, we didn't include an outcome analysis such as stroke prevention or bleeding rate reduction. But in conclusion, the majority of patients are eligible to switch from warfarin to dabigatran. However, the drug costs alone do outweigh some of the smaller therapeutic costs of